So, welcome everyone. Thank you for being here with us today. Our speaker is Adam Stroges from Penn Medicine. Adam is based at PCAM, the main center, and today he's going to speak about the patient experience and how they use SDX at UPenn. So, if you have any questions, just like for other webinars, please feel free to use the chat. You can write them, and we will answer at the end of the presentation. Adam, the floor is yours.
All right, thank you, Annabelle. Appreciate it. I'm glad everyone is able to come and see this presentation. Bear with me and let's go take this on together and learn a good SDX presentation here, okay? So I just wanted to thank you guys for taking the time out of your busy days and learn some experience with utilizing this spirometry-based respiratory gating system. I want to thank Annabelle for helping me during this process and giving me this opportunity. I truly believe that using breath holds as a treatment technique is extremely valuable and necessary in patients' treatments. So here we go. Just a little bit behind my introduction, my background is I graduated from a 4-year program at Misericordia University, got my bachelor's degree there, and then went on to study more for radiation therapy at Washburn University. I currently am employed at the Hospital of University of Pennsylvania and have been here for about a little bit over 3 years. I've been a radiation therapist for over 6 years. I was somewhere previously before this. And the reason why I'm here today at PCAM is unfortunately, when I was very young, a family member was diagnosed with a brain tumor, and I had made it a passion and a goal for myself to end up here at the University of Pennsylvania because my good friend Paul was treated here. So after learning about cancer and everything that he had to go through, unfortunately, he ended up passing away, and it really turned my life for a betterment and to put a goal and set forth and get to where I am today. So our purpose of this webinar is we are going to discuss the benefits of utilizing SDX as a treatment technique. We're going to dive into the patient's perspective specifically. I want to hone down on that and give you viewers the perspective that a patient has here at Penn and here with using the SDX equipment. I will be showing all the major components that are necessary to achieve success and what a patient uses for their treatments. I have a video attached as well because explaining things, it's always good to have a visual with it. Some people see things differently than the way I explain, so I also want to utilize a video during this presentation. So as of right now, let's take the time to see how a patient visualizes through the goggles that are given and must wear for their treatment every time they come for treatment. In the beginning, when you go get your patient, I've had a lot of experience in the simulation process, their very first day. So the CT simulation can be overwhelming for any patient. Unfortunately, it's overwhelming for every patient who's dealing with cancer. So my goal is to be as compassionate and be a helpful coach the whole time during this, during their treatment, during their SDX training, just in general, give a helping hand. And I really want to focus on the connection that a therapist has with the patient. It is important to understand that you should be compassionate and helpful through their entire time receiving treatment. So while explaining and coaching the effects and the SDX breath holds for a patient's treatment, you have to remember that they are already given so much information in a short period of time. So this is really crucial this first day to take the time, take a step back, give them time to understand how this breath hold can be very successful, how the SDX equipment can help them with a better treatment. And then we should always treat all of our patients with dignity and respect because I like to say it, I treat every patient that I ever see as if they're my family member or a close relative. Anybody that comes through these doors and unfortunately is dealing with fighting the good fight against cancer, we want to make sure that we're able to be understanding and confident with what we're doing to help them to receive the best treatment. So I'm kind of gonna explain the process to a patient, like as if I'm explaining to you guys how I explain to our patients as well. So I always go on with a smile. I make sure that I'm being as joyful, positive, but then there's also times when you need to know sentimental and how to be understanding too. So when I go in, I try to make a connection. I try to bring light, encouragement, and a good thing around here at Penn is that we get to have our SDX trainings for an hour, which is great because unfortunately sometimes it's a lot for the patient to understand what's going on. So we schedule enough time to get them through their training and get them through their simulation. And it's important to make sure that you're honest with them and to make sure that this whole SDX and training is a good choice for them. It's great. It's good to get accurate information to help the patient succeed. And all in all, this is a treatment that has been proven to be very successful with treatments. It's very necessary in certain needs. So, when I go get a patient and bring them back to the CT simulation, I always ask a weird question. I try to break the ice. I always ask, have you ever been snorkeling? Snorkeling, scuba diving? Have you ever held your breath for a long period of time underwater? It's a weird question to ask, but the only reason why I ask that is so that when we time to do the breath hold training, the pieces we utilize, the equipment that we utilize is kind of resembles a snorkel or scuba diving equipment. So if I'm able to get a patient to kind of like relax a little bit more after asking that question, then I've done my job in trying to help them out and get them through this process. It is extremely important to use breath holds in order to help spare organs that are at risk, which are also known as OARs. We use the SDX and breath hold trainings for our lung cancers, left breast specifically, because our heart tends to hang on more towards the left side. And we also use it for abdominal, like your kidneys and liver. So we utilize the SDX and breath hold training quite frequently, and a lot of our patients are successful with it, and they are able to have a very good treatment and get through everything. Now let's get into some of the technical and behind the scenes that a therapist does with the SDX. So every morning when we come in, SDX has a warm up that needs to be done. The warm up is basically turning the machine on, making sure everything's calibrated correctly. We utilize the syringe that's pictured right here, and we go through like a simulation as if a patient was on the table just to make sure everything passes. It's extremely important that we have multiple of these so that in the morning we get every one of them warmed up just in case a different machine needs to use our SDX. We're able to interchange them because all of our machines here are compatible. We have proton therapy here, we have halcyon treatment units, linear accelerators, and 3 different CT simulations as well. So here are the major components that I want to go through one by one. The SDX, the spirometer itself and the mouthpiece, they're all connected right in here. We also call this long neck here the gooseneck, something to try to make it easier for patients to understand. Kind of resembles a goose's neck. We utilize the nose clip, which is pictured right here. The ergonomic visual goggles, which a patient wears for all of their treatments and gives them the capability to see the therapist's screen for treatment. And then everything is able to stay on this trolley as well, so it's easy to transport, doesn't take up much space, and it's easy to be compatible with all of our treatment machines. Now, I even went more into depth and put in some pictures of our pieces that we have here at Penn. So this mouthpiece, the entire thing up to about here goes into the patient's mouth. They gently bite down on it, and this gives them the leeway of breathing through only the mouthpiece. We utilize the nose clip as well because we don't want the patient to be breathing out of their nose. We only want the patient to be ended up breathing out of this connection here only. Every patient gets their own mouthpiece, gets their own filter, and these are the goggles I was talking about. We clean these daily, clean these every time after every patient. It's important to make sure everything's clean and utilized in a proper manner. It was difficult, but I did attempt to get a picture of the exact visual of what a patient would see. So if we were wearing these goggles currently right now, this is a small picture. I have better pictures, but this is a small picture of what the patient actually sees while wearing the goggles. Um, Now, as we get into this slide, the patient's visual lights, their indicators, I call them as well. This slide is very important because now we have the patient set up. We have everything successfully operating. The patient's arms are normally above their head for all treatments, unless they can't bring their arms physically up. So let's take this as if I'm explaining to you as if you were a patient. This is how I explain things to my patients. When they come into the room, when they're wearing their goggles, we elaborate on their own threshold. Every patient, we design their own threshold, which is this solid green bar going across. This red jagged humps and valleys right here is the patient breathing normal. After about three to four normal breaths, the machine has recognized the patient, and we tell them to take their deep breath in and hold it. So the patient takes their deep breath in, they hold it, and we want to see this straight bar going across in their specific threshold. This is a great indicator for the therapist that the patient is understanding everything, that they're not going to have any issue for treatment. And we also use these lights to indicate, because when they do come back for treatment, we won't be in the room with them. We can hear and see them at all times, but unfortunately, because the radiation is on, obviously, we can't be right next to them like we are for CT simulation. So when this green light indicator shows up, which is great technique, it's the lighting in here is beautiful because this green light, green means go as normal. When they're ready to take their deep breath in, the green light shows up. They go ahead, take their breath in and hold it. Now we'll go to this middle page here. Once the patient is specifically in their threshold, once they're holding their breath in the green bar, this orange light shows up. That would be the indicator that radiation is technically on. So we go through this and coach patients through this many of times because it is a lot in the beginning, but that's why we schedule an hour for their trainings. We schedule an hour for training to go through all this to make sure they feel comfortable, to utilize the time to get to know them, to utilize explaining as much as possible as we can, because it normally takes about 8 days roughly for the patient to come back for treatment. So we want to make sure that we coach them thoroughly. We make sure that they're happy with the decision. And then we want to also make sure that they understand that we won't be in the room with them for treatment. So as I explained, this orange light, that is their meaning that when they take their breath in and hold it, they're in their specific threshold and that the radiation is being delivered now. Once the patient sees this red light here, again, red means stop. So the patient is able to let go and let their breath out. So I will explain this as many times as it takes for a patient to fully grasp it. However, in some scenarios, there is times where the patient can get overwhelmed. They're beginning to cry a little bit. It's too difficult, or it's just the whole scenario is not going well with them. Then we take a break and try again. But we always try as much as we can unless they are not feeling up to it anymore. The good thing about the SDX training as well is when they're done with training, it's great to tell them that they've passed. They're going to be excellent candidates for treatment because treatment's even quicker than the training. Here at Penn, we do 15 to 20 minutes on our linear accelerator treatments, and we give them even a 50-minute time slot on our proton therapy treatments. Everything's very quick, and it seems that the patients aren't having any trouble when they come for treatment then, which is excellent. Again, like I said, explaining is a lot difficult to do just by word of mouth. I did want to show this video I have here. I think the video kind of explains in more in detail of all the components that the SDX uses, and it gives a great visual of how a patient's tumor or a patient's area we're treating stays way more stationary while holding their breath. Again, making this decision of breath hold and SDX an awesome decision for treatment. So I'm going to play this video, kind of voice over what's going on here just to give you guys an understanding more. So here comes the video. So as we see here, the patient is set up. They have their goggles on. They've got the mouthpiece and filter placed in. This is their visual they would see with the goggles on. Currently, the patient is breathing normal. As you can see, they're breathing normal. Internal anatomy is shifting all over the place. The patient takes their deep breath in and holds it. Their internal anatomy is super stationary now. This is amazing to see with just their simple breath hold, which this SDX machine gives us. Again, the patient is breathing normal here. Internal anatomy is going all over the place. Once they hold their breath, like the visual is gonna show now, everything becomes super stationary. This gives a great time for radiation to be on, target simply what we're looking to target, and save healthy organs, save healthy tissue. So it's a beautiful equipment that we're able to utilize for treatments. Now the video just takes a second here. Just going to show you a free breathing method. Now we can do this also with our 4D scans. So this is like a 4D scan, what it's showing right now, how much the tumor can actually move while just breathing regular with free breathing. It's bouncing all over the place, but while you're holding your breath, that tumor, that area we're treating is super stationary, giving the doctors an easier chance to target what we need to be treating. Again, here's another visual of how much truly internally something can be bouncing around. And we're able to utilize this with our 4D imaging as well. So if we're doing SDX though, what's bouncing around here is going to become very stationary. Again, that gives our beam, our radiation treatment become more successful and only treat the area that needs to be treated. We're able to save patients' opposite breast. We're able to save patients' heart volume. We're able to save anything that doesn't need to be treated in the abdominal region. Let's go to the next slide. So here are some more examples of basically what that video was showing. And like I had said, we utilize this treatment, the technique, the SDX, for left breast a lot. We even started using it for right breast too to help save the lung volume. So here down this corner, it shows where your heart comes on over towards the left lung side, towards the left breast. That's just normally how your heart falls. Now with radiation on and the breath being held, so we're using deep inspiration breath hold here, that heart is able to come so much further away from the left breast, therefore sparing heart volume, not getting any radiation to it, which is amazing. Over here, this is more what we see in CT simulation. we're able to draw a thin line going across both sides here to show that this part of the heart in free breathing would be getting treatment, unfortunately. We don't want any of the heart to be treated. So when we do our DIBH then with the SDX module, we're able to bring that heart away from the left chest wall. We're able to deliver all of our radiation to a specific area that we need to be treating. Here at Penn, this is what's compatible with the SDX module. We are able to utilize our own vac locks. We're able to utilize our proton therapy unit down here, our CT simulation, our true beams, our linear accelerators, and our halcyon. When doing SDX training and when trying to figure out if a patient is a candidate for any of these treatment machines, all of our setups are compatible with the SDX training. The SDX we're able to utilize on all of these machines. There's no issue with it. And the big thing about this is that patients are able to then also come in and get a successful treatment while not having to worry about getting any extra dose to certain anatomical spots in their body. So I know I went pretty quick there. I tried to slow down as much as I went. I was practicing all day yesterday. It's my first webinar. I wanted to try to be around 30 minutes. Looks like we're at a 25-minute mark. I would like to open this up to any questions now. If anyone has any questions, feel free to ask, and I'll try to answer the best of my ability.
Thank you, Adam. That was a
Thank
great
you, Annabelle.
presentation. So we do have some time to answer questions now. Like we said, you can use the chat for that. And then Adam also is willing to leave his contact information, right, Adam?
Yes, right here.
Wonderful. So if you have any questions, you can also feel free to contact Adam um, to know more about how they use SDX at Penn. So we do have one question for you. What is the youngest patient you have trained with SDX?
So we've actually gone down to probably about the 10 age that I've successfully passed a patient, 10 to 12. Um, a lot of times it's a little bit more challenging then, but actually it's surprising. They do surprise you a lot because how the world's changing and like how video games are getting big and everything. The younger patients do tend to do pretty well with it, and they can hold their breath for a long time, which is great depending on where we're treating. But I would say that's about as young as I've successfully passed, but maybe some people have seen even younger. But it's pretty amazing how the young patients can do amazing with it too, as well. And same with the older patients, but I would say 10 to 12. I think I've successfully passed.
10 to 12. That's quite young. We do have other clients using SDX connected today, so feel free to tell us about your experience as well. I wanted also to piggyback on your answer. Um, we have designed a little dragon. So it's a new patient visual application. It's a little dragon that flies up and down that is available with the new version of the software right now. If you want to see it, you can go on our YouTube channel, on our website, and you can see how it works. So this was designed thinking specifically for children. We work with a lot of proton centers, especially in the US, and also big universities, and they tend to have more pediatric cases than other, maybe smaller centers. So we came up with this application.
Yeah,
Actually,
and
we
I've
have,
seen that video before. It looks pretty cool. I've seen it. Yeah.
yeah, thank you. So we do have a lot of questions in the chat, so I'm gonna read them to you.
Okay.
Um, could you say again what the LINAC time slot is for use of this treatment?
Yeah, so
So,
here they extend the time a little bit longer. Um, I know on their first day, the setup days are, I believe, around a 50-minute time frame. Then they do about 20 to 30 minutes. And on the Halcyon, it's even a little bit quicker. I'm not specific on the Halcyon. And then our proton machines, we normally limit to about a 50-minute time slot because protons, unfortunately, we have to wait for the beam a lot. So our time on proton is a little bit longer. That's the only reason why.
Yes, you have IBA Proteus Plus, correct? So you
Right.
have to wait for the beam is shared between different rooms.
We have five proton machines and we have one source. So if we technically have to wait in line again, like you're in kindergarten again, and when it's your turn to get the beam, then you can use it. But then say I have it first, I'm on proton five, and proton one needs it, they have to wait till I'm done with it in order to utilize the radiation.
Right. So technically, people that have single rooms would not have to wait that
Correct.
long,
Yeah.
correct? Yeah.
Yes.
Right.
And actually, there was people from Florida here a week or two ago. They're having one vault, and they asked us our time frames, and then we told them 50 minutes, and they said, "Well, we're only having one." So I said, "Probably about like 30 minutes, then 20, 30 minutes, I would think."
That's reasonable.
Yeah.
Okay, we have a lot more questions. Do you have some patient stats about how comfortable patients are using the system and breathing through their mouth?
So to answer that, do you have some patient stats? Not specific stats. Maybe like our physics department team does here. All I know is that as I'm coaching and just being in the CT simulation portion, who does all the coaching, it's pretty successful. A lot of people are passing. The only time that I really ever not pass someone on SDX is when at the end, I can just see that they're so overwhelmed, they're upset with what's their diagnosis, and they just want to come back a different day. So that's like the only time I really don't pass someone there, or if their unfortunate cancer is too much, and then like the lungs, they can't hold their breath that long. So that's the only times that I ever don't really pass someone because when they go for treatment, then I don't want them wearing themselves out then as well. So sometimes I do have to step in and say I don't think it's the best option, but that's just from my background.
Okay.
But
That actually answers also the other question that we had right below. Do you ever have patients that don't pass the training? And if not, how do you then approach treatment?
oh, so yeah, so like I said, unfortunately, it does happen sometimes. It's not often at all. We're pretty successful with getting patients to use XDX, but if they don't pass it, we'll contact the oncologist or attending for them. And normally, depending on where we're treating, they'll just tell us to utilize a compression belt then.
And talking about statistics, there is a paper from the University of Maryland Proton Treatment Center with Dr. Puya Sabori and Dr. Sina Mosahebi. They actually ran some stats and they noticed that they have an about 86% success rate. So whenever the physician asks the therapist to try and train a patient, they're successful in about 9 times out of 10.
Yeah, and I would agree with that.
Yeah.
I think that's
Yeah.
very, I'd love, and it's getting someone to pass just feels so good as like a person for like the therapist too. And I think the patient totally understands what's happening some with it too. So they like to, it's just a good warm feeling when they do pass it.
Yeah. We have another question about the coaching. During the coaching session, how do you initially determine where the green bar is positioned?
Good question. So while we're doing our breath hold training, we tell the patient to take 100% max capacity, and I'll take about 3 to 4 of those and then design a threshold that's based off of 85% of their 100 or 75% of their 100. Our protocol here is we do 85% for any breast treatment, and then we do 75% for anything in the lung or the abdominal region. Anything other than breast, we do 75% of that 100. And then breast is 85% we do.
And I can say also that a lot of centers are using the same numbers. Um, Visiting our clients, I see their procedures, and this is a classic number. Okay.
Yeah, it seems to
Um,
work very well.
yes. Well, it's a good compromise between keeping all the anatomical advantages of doing breath hold and at the same time keeping the patient comfortable so they don't move, which is obviously the ultimate goal.
Right.
Um, yeah. We have one more question. Have you had issues with visually impaired or hearing impaired patients? Any plans for making the line thicker? It's a good question.
That's a good question. I'm not sure about the line being thicker. That wouldn't be my expertise, but I do know patients who do come in with glasses like I'm wearing. We are able to, you can still wear your glasses and put the goggles on at the same time. We do that. I just did one last week like that, and I've actually used the equipment before, and it we do put a little piece of tape on the one side to keep it from moving, shifting too much with people who have glasses on, just so that helps keep them stay on. But it's totally usable with patients who have glasses.
Right, because especially when you're lying down, they will just rest on top of your regular glasses.
Right.
Makes sense.
So we haven't had and any plans for yeah, the making the lines thicker. I'm not positive on that. That'd be a good idea though. I mean, I don't know. Maybe that's a manufacturer thing, or do I have the capability of doing that?
You can. You can
Okay.
actually. It's more a question of reproducibility. So the thicker the line, the less reproducible you'll be because it gives the patient a larger tolerance zone. So let's say the patient during coaching, they do 2.5 liters, and then if you make a larger tolerance zone, then perhaps they'll go all the way to 2.7 and from 2.3 to 2.7, and this it will the internal positioning will be less reproducible, although it will be easier for patient to reach that area. And
Okay.
on the opposite, if you make the zone smaller, then you'll be more reproducible, but it might be a bit more challenging for patients to reach that zone. And some of our clients have actually noticed that with younger patients, they can make the that green bar smaller, and they will still be able to be very precise, as opposed to for sometimes older patients, which may have more, it may be more challenging for them to do it. Then sometimes keeping the line thicker is easier for them.
So, Annabelle, is that the green bar we're talking about? Is that what she meant by keeping the
Yes,
line? Okay, now the stability
yes.
zone or whatever it's called.
The green zone, which is the breath hold
Yeah.
zone. Yeah, the
Okay. Yep.
stability zone is the gray area in the
And
bottom.
then the other one is the green. Okay, now I know what you're talking about. Yeah, we
Exactly.
don't really
Yes.
change it from the first day that they come to treat or come to CT simulation. It normally just stays the same throughout treatment.
Okay. All right. We still have some time for the questions, so please use the chat if you want to speak to Adam today.
Is there anything?
There's a lot of people connected, so I'm sure there's still more questions. You can also reach out to me if you have any questions, and I can put you in contact with the team at UPenn. I'm going to leave my contact information in the chat.
I guess I could just add too. I'm not sure if I mentioned it, but in order to pass our SDX training here at Penn, we try to have the patient hold their breath for 30 seconds 2 times, just so that when they come back for treatment, they're not holding their breath for like 5 seconds, 8 seconds. It can be quicker that way. The more they can hold their breath, the quicker they can get through treatment. So that's just a big indicator on pass and not passing here. But I'm not sure if I had remembered to mention that, but I just going back on my notes, I wanted to make sure that you guys heard that. We do 2 attempts at holding your breath for 30 seconds in order to be successful with the treatment, we think.
That's interesting. That's a high threshold. It's a high value. I've seen in
Yeah.
other centers it's more about 15 seconds.
We do 30, we accept 25, but we strive for 30.
Okay.
Yeah.
And do you notice in your experience, do you see patients doing better with time? Let's say if they have 60 sessions,
Yeah,
do
for
do
sure.
you see them doing better? Yes?
Yeah, a lot of, and it's pretty amazing to see when some people, like their very first day, when they're overwhelmed, when they're upset, some patients come in and just crush it immediately. And they'll say, like, I was practicing at home because so and so, my oncologist, so and so, my doctor told me to practice at home. So you can notice the patients come in who are actually practicing. It's pretty cool to see.
That's great.
Yeah.
Do you give them sometimes the mouthpiece and the bacterial filter to practice at home, or do they just practice without it?
I think they're just, we don't give anything to go home with. So they're just
Okay.
probably, the one patient was like, I just lay on my couch and I put my arms up and I hold my breath. And you can really tell when some of them come in, they're like, wow, they're doing a lot better than they were previously. And
And
even patients,
that's
we've
good.
had them come and on, they're either have like a little cold and they're still able, like a cold and get through treatment. Like they're still able to get to their threshold. So it's pretty big on the simulation therapist to get them to pass. And being able, like just my experience, have done treatments with it, CT simulations with it. It is great to see how amazing they go from their CT simulation to treatment and still be successful with it.
Hmm. Great. So everyone, as you can see, Adam has a lot of experience with SDX. Feel free to use the chat if you want to hear his answer today, or you can also reach him at the email address that's on the slide here.
Yeah,
There's no bad questions. Feel free to
I
ask
love to talk.
anything.
I'll talk to anyone too. I'll talk to this wall next to me. I'll talk to anybody.
So we did good picking you as a speaker.
I hope I did all right. That's like I said, that's my first one I've ever done. So I was
Well,
pretty a little nervous, I won't lie, but I think it was good.
it was a great presentation.
Thank you. Appreciate it.
All right, so if we don't have any more questions, I think we're gonna let Adam go back to his patients. Oh,
Thank you guys.
all
Appreciate
right.
listening and hopefully you guys learned at least one thing from me. I would love that. Feel free to contact me anyway too. I don't care. My personal or phone number work. I don't mind.